Wonderful. So here we are, Beyond Roe. Reproductive justice is the way forward, and it's an honor to be here. Like Dr. Taylor said, this past Saturday was the year anniversary of the fall of Roe. When Roe fell, a lot of things changed for us as an organization and as a society. And so since then, we've been working hard on finding ways to come up with solutions to what was lost when Roe fell. And just to ask kind of like a show of hands, does everyone know what I mean when I say when Roe fell? If you don't know, you can, yeah? Okay, great. Someone doesn't know and needs some more explanation about that, please set in the chat. You can let us know and we can go into that a little more. You know, it was a momentous thing that happened, and we're looking at ways to move forward and solve the problems that existed even before it fell. So, welcome everybody. Housekeeping, chat away, please. Use the chat, make comments. Don't be shy. You know, if you have questions, comments, concerns, please use the chat freely. Like I said, the Q&A will be at the end, but also throughout. You're welcome to use emoji reactions. I love to see them. It lets me know that that you're getting it, that you understand, and that, you know, I'm hitting a nerve. The webinar is being recorded and will be sent out to some folks. Afterwards, it may take a few days. And then also closed caption is available. Sometimes it's helpful, and you'll see if you look down on your screen, there should be an option for caption, so you can read along if that is helpful for you. We'll move along. So let's review some of the goals for today. We're going to talk about reproductive justice. And so one of the goals is to understand what reproductive justice is. We don't want to assume that everyone knows, and it's a concept that's sometimes a little nebulous for some folks. So we want to spend some time talking about it. Secondly, we do want to learn where Roe versus Wade fell short. And this is where we can intersect reproductive justice and where abortion access just wasn't enough to get us to where we need to be in terms of having healthy communities. And then we want to talk about preparing for what RJ could look like in Arizona. So just getting a taste of what that really looks like. What could that mean for us in this state? I'm going to be centering Arizona, but really this applies to many states. As we know, there are some states that have a lot more access and a lot more support for families and individuals. But there are quite a big number of states that still need a lot of work, that still have similar challenges that we do in Arizona. So hopefully this is something that you'll learn something from today, and maybe you'll see something that might be similar, or you see something reflected in your own state. So glad that folks from other states are joining us. So we'll go over the agenda today. Let's talk about reproductive justice. We'll talk about who we are first as an organization, and then we'll talk about reproductive justice and define it. We're going to talk about Arizona and where we're at the moment. Talk about why Roe didn't cut it. It wasn't enough. And then next steps and the future ahead. So let's talk about the Registrar Institute for Family Planning. It is my pleasure, my honor, my just great joy to be a part of this organization now for a little over a year, although I've been working with Desert Star for a few years in coalition. And so we are a Black women-led nonprofit reproductive justice organization, 501c3, that's based in Arizona. Our mission is to create equitable access to reproductive health care for womb-bearing people while centering Black and Indigenous people of color. Our vision is to have access to the full range of just, dignified, and exceptional reproductive health care that is available to people who can become pregnant regardless of circumstance or zip code, and is provided by compassionate healthcare professionals who also advocate for reproductive health and justice in their communities. And if you could see in the photo, it's a photo of Dr. Taylor participating and leading in abortion training within the program that we have This was happened in the past before Roe fell, but there's participants, medical students that come from all over the country to come learn from Dr. Taylor through our program, the next generation of abortion providers. And so it's a really powerful program where medical students get pivotal training on abortion care and services that they usually cannot get almost anywhere else in the country. So let's talk about reproductive justice. And here's some stickers that we like to share at our events. Healthcare for the masses, not the classes. And all pregnant, birthing, and postpartum people deserve love and care. So I want to start with the definition that we like to use, a lot of people use, which comes from Sister Song, which is an organization, nonprofit that is based out of Georgia. Their definition says, the human right to maintain bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. So what does that mean? That means that reproductive justice is a human right. RJ is based on the United Nations internationally accepted Universal Declaration of Human Rights. It's a comprehensive body of law that details the rights of individuals and the responsibilities of government to protect those rights. So this is not just something that affects America, it affects all countries in the world, and it has been agreed upon by many, many countries that it's a basic human right. What does it mean? It's not about access, it's about access, not choice. Mainstream movements have focused on keeping abortion legal as an individual choice, right? The pro-choice movement. That is necessary, but not enough. Even when abortion is legal, many women of color cannot afford it or cannot travel hundreds of miles to the nearest clinic. There is no choice where there is no access. And we'll talk a little bit more about what that looks like in a state like Arizona. And it's not just about abortion. Abortion access is critical, and women of color and other marginalized people also often have difficulty accessing contraception, comprehensive sex education, STI prevention and care, alternative birth options, adequate prenatal and pregnancy care, domestic violence assistance, adequate wages to support our families, safe homes, and so much more. So this is just kind of an introduction to what reproductive justice is, right? There's so much more than just having the right to have an abortion. It's important to have that right, but it's hard to have that, to exercise that right when you can't afford or have access to abortion care near you. So here are the core principles that are part of RJ. You have a right to decide if, when, and how you will grow your family, become pregnant, give birth, adopt, or parent. You have the right to decide if you will not give birth and use your right to prevent or end a pregnancy. Give me 1 second. I'm sorry, give me 1 second. Thanks, y'all. Sorry, that was my kiddo. So 3, you choose how to parent your children with the necessary social supports in safe environments and healthy communities, and free from fear of violence from individuals or the government. So that means that it doesn't, even if you choose to have children and you choose to raise them, what if the environments aren't safe, right? If it's not a safe and healthy community, then is it really a choice of having a healthy child and being able to have the support you need without having to fear violence from the government or other people. You have bodily autonomy, free from all forms of oppression. And number 5, you have the right to express sexuality and spirituality without violence or shame. Religion or your spiritual belief should not affect whether you're free to express yourself and do what you need to do with your body and with your reproductive health. And number 6, you have a right to quality of life and sustainability before and beyond the ability to give birth or parent. So that means that it's not just about having children or not having children. As generally speaking, if we live in healthy communities that has high quality of living, then we are practicing reproductive justice and being able to provide that for all. So how it started. So the term reproductive justice was invented in 1994, right before attending the International Conference on Population and Development in Cairo, where the entire world agreed that the individual right to plan your own family must be central to global development. A group of black women gathered in Chicago in June of 1994. They recognized that the women's rights movement, led by and representing middle class and wealthy white women, could not defend the needs of women of color and other marginalized and trans people. We needed to lead our own national movement to uplift the needs of the most marginalized women, families, and communities. And as a note, this information can be found on sistersong.net website. A lot of this information is available there. So these group of women named themselves Women of African Descent for Reproductive Justice, and RJ was born. Rooted in the internationally accepted human rights framework created by the United Nations, reproductive justice combines reproductive rights and social justice. The progenitors of RJ launched the movement by publishing a historic full-page statement with 800 plus signatures in the Washington Post and Roll Call. Just 3 years later, in 1997, Sister Song was formed to create a national multi-ethnic RJ movement. This is a group of some of the original folks that made it to that meeting and newer folks that are part of Sister Song. So let's really take it back. This is how it really started, right? Before 1994 and for many thousands of years, reproductive care was managed by midwives and wisdom keepers and healers that existed in all of our clans and tribes and communities all around the world. These were people that had medicinal knowledge, they had ancestral knowledge, and they cared for all the reproductive care, not just births, right? They took care of all the rites of passages of every human being, including women and men, children, and death. And so they held on to those practices for many, many thousands of years, including the Black Southern midwife. There's a picture there in the bottom center, who really birthed the nation here in the United States. When chattel slavery was happening here, there were no doctors or hospitals, and they were the ones that were in charge of bringing in new life and caring for people's reproductive care for hundreds of years. It wasn't until the 40s and 50s that there was a campaign to basically put them out of business so that folks can start using doctors and doctors' offices and hospitals. But up until then, even masters of the slaves and slave owners used the work and the care that these Black Southern midwives offered. So we want to remember that reproductive justice looks like this too, because they did not turn people away in their community. They offered care to every single member of their community, regardless of whether they could pay them or not. Often it was not a paid service that they provided, it was just the role that they had in their communities. Now let's talk about Arizona. And I'm glad that someone mentioned about, what this is really reflective of, can be kind of reflective of what other states may be going through. But unfortunately, Arizona is just one of those states that has a lot of challenges to having a healthy life and a reproductive life. Abortion bans in Arizona as of now, our abortion is banned 15 weeks on. So it's legal up to 15 weeks. However, it can only be managed by a physician. Anyone else assisting any abortions, whether it be through medical abortion, prescription abortion, or let's say herbal abortion, can be prosecuted, can go to jail for 2 to 5 years, and can face litigation. There's an immense amount, of course, and let me mention, there is a total ban that is still in effect that was instilled in 1864. That's still basically on the books. At the moment, it's not. Physicians are allowed to perform abortion up to 15 weeks. Thanks to a law that was signed last year. However, it's still officially illegal to have an abortion. As the books look, if you look at the books, at the laws in Arizona State, those laws are still in play. There's also lack of funding for education. Arizona consistently falls 48th and 49th in the country for education funding. That includes everything from, kinder to 12th, and even in college years. And the state continuously underfunds in education over and over again, in no small part due to the choices made by our legislators that have been in power for many years. Low access to state Medicaid. Arizona has an option, like many states do, to opt in to have additional Medicaid resources sent to Arizona from a federally funded Medicaid program. And year after year, or time after time, Arizona opts out of receiving those extra funds that would come at no cost to Arizona. And so, besides that, the Medicaid coverage usually covers a lot less than the going rate for many of the services that families and individuals need. There's really no or little care providers available in rural areas. Arizona has the largest population of tribal people. The Diné, the Navajo tribe, is the largest tribe in the country, and they also have the largest land, tribal land or reservation, in all the country. On that land, and in most of Arizona, including northern Arizona, there's no abortion providers. There's no abortion care, surgical abortion care that's given. And this really affects folks that don't have maybe reliable transportation readily available, or they're low income. It makes it very challenging for folks to have to drive hours and hours away to get care, and let alone like appropriate care, or care that responds to their cultural needs. Environmental attacks. Unfortunately, Arizona also ranks high in poor environmental, um, environment, poor healthy environmental state of being. So, for example, there are areas in Arizona or in Phoenix that have seen higher cancer rates due to low quality of water. There's industrial waste that affects South Phoenix, and it affects actually birth outcomes, and increases the level of miscarriages that folks in that part of town, which is also a low income, mostly Black and Latino part of town. Um, there's a lot of financial benefits that many large corporations get by having their business here, their industrial business here, and they get those benefits like lower tax rates, and then they also just get to just make a mess of our environment and pollute our environment to the extent that it affects our health and well-being. And those things have continued to happen throughout the years. Poor working conditions. So it's a right to work state in Arizona, which means that there are very few assurances to have sustainable work environment. It's also a place where there's a lot of immigrants that live here, many of them undocumented, and they have to they have to put up with extraneous work hours, no health care, very little amounts of rights, and support that they have that are state or federally, mandated. And so imagine, someone that needs to go and have reproductive care, or needs to make an appointment. For example, if they want to have an abortion, they have to go one day to get an ultrasound that's mandated, and they have to take time off from work, and then they have to, by law, wait 24 hours to come back and get the abortion. And so they would have to again take time off to come and do that, or get child care covered, etc. There's a lot of conditions here that make it very difficult for folks, especially low income, poor folks, to have healthy health care, to take care of themselves. And one of the biggest of them is inhumane prisons and criminalization. Arizona is known for one of the worst prison systems in the country. The cost of healthcare is very high for prisoners compared to what they're allowed to make, and they have to pay for their own healthcare. So they have to actually pay out of their own commissary to be able to go see the doctor for any condition that they have. We have many cases where folks have lost their lives that could have been easily prevented because they weren't able to access health care while they were imprisoned. And so that includes, recent report that came out last year of the women that were imprisoned in Arizona that were forced to have inductions of their pregnancies that came out. And so there's some grassroots organizations that are trying really hard to make those situations known, but also see what legislators can do and what folks can do to create some change. And of course, criminalization. Arizona undoubtedly, unfortunately, criminalizes Black and brown folks, Latino folks, and Native Americans at a much higher rate across the board than other races, which means that we see a lot more poor Black folk, poor Latino folk in jails. And something like, for example, if you are a person, let's say a mother who ends up getting incarcerated, more likely than not, more often than not, you lose all parental rights as soon as you become a felon and are in prison, which means that the court takes away the right for them to raise their children, and those children end up going into state custody and have very unfortunate outcomes. As you may know, state custody and the system that the children have to go into are not well funded, and they're not well taken care of, and so it just sort of snowballs into a horrible life for those children. And of course, even when the mothers come out, they have to fight really hard to get the custody of those children back. So these conditions existed before and after Roe fell. Now, what about Roe? Roe did provide some protection for abortion. It did provide the ability to have abortions up until what was considered viability. And so for Arizona, that was up to 24 weeks. But it didn't make it easier to get an abortion, especially in those rural and northern areas like I mentioned. For example, in northern Arizona, it's known that for at least 20 years they had not seen surgical abortions had been performed. It didn't really address access to quality abortion care nor reproductive care. And so, like, compared to, let's say, California, that has over 800 clinics, abortion clinics, or abortion, providers, this Arizona, maybe you can count with one hand how many abortion clinics were open before Roe fell. So you can imagine, as you can imagine, it was still very challenging for folks to be able to access abortion in a timely manner, um, let alone, really quality reproductive care. Arizona still, before and after Roe, had high numbers of black birthing people, black maternal mortality rates, right? So systemic racism still disproportionately affected black folks in Arizona. Lower income people, pregnant people, and most of Arizona still struggle to access care. And so that's like what I mentioned before. Um, and then criminalization and racism still disproportionately affected people of color Arizona. Yeah, that didn't change before Roe, when Roe was still in effect. So when we talk about Roe, we talk about this idea of pro-choice, which comes across as reproductive rights, and then so we want to talk about what the difference is between reproductive rights and reproductive justice. Thank you, Dr. Taylor. Dr. Taylor is the expert on the abortion abortion clinics, and she's clarifying there in the chat. And so the reproductive justice framework acknowledges that the ways that socioeconomic status, gender, and race shape reproductive health care experiences and health policy. Essentially, the reproductive rights framework is a more individualistic and legal approach, while reproductive justice is expansive, intersectional, and holistic. And this is from Danielle Empacia from the Petrie Flum Center, Reproductive Rights versus Reproductive Justice, Why the Difference Matters in Bioethics. So, when we talk about folks fighting for the choice, for having the choice for abortion, it doesn't really talk about the fact that you're not talking about, where people are living, their economic status, do they have the rights at work to take care of their reproductive health? There's so many other things that affect the health and well-being and reproductive care than just having the right to have an abortion. So let's talk about what we can do. And this is a simplified version. There's so many things that we can do to support to start at least changing the narrative or changing the experiences that people are having. Advocacy is a huge one. Advocacy is like learning and talking to who makes laws and let them know what is going on and what they need to do. And so that really requires learning, like you all coming to this, to this webinar, learning a little bit more about reproductive justice and learning about what's going on in the state, in your state, and then making the connection to the folks that are at the Capitol, letting them know the challenges that are actually happening and letting them know that they need to do something about it. Education. There needs to be more training on RJ. We offer training on reproductive justice. This is just an overview, and human rights and sexual education. It needs to be available to as many people as possible, so that they know what their rights are. They know what's available to them, and what is actual good care for them. Storytelling is a huge, huge one. We have to talk about abortion. We have to say the word abortion, and we have to tell our stories. How was it? How was our experiences? A lot of the times there's shame and stigma about talking about our reproductive care, especially femmes and females and women. We've been taught to not share these things, sometimes with our close family members, but we have to learn and practice telling our stories in our families so that younger people coming up can hear those stories and they can be informed and they can know what their rights are and know what may be possible for them. And of course, in our communities and our governments, stories are one of the most powerful tools we have. When we feel like we have no power, we always have our stories. The support. You can support organizations like ours and other organizations that do great grassroots work to support individuals that are having challenges. If you know someone that's pregnant, that's looking for an abortion, that needs some support, even just listening to them, asking them questions, and trying to help in some way to relocate resources for them. Families need a lot of support. Parenting is very hard these days, and if you can help support them with resources, or just listening to them and offering in an ear, letting them know they're not alone, This is the way we build healthier communities. What else can we do? Let's get more specific. Support independent abortion clinics. Yes, independent abortion clinics often do the work that larger clinics cannot, and they're super pivotal in providing access to folks like immigrants and BIPOC folks. Support birth workers of color. So that looks like doulas and lactation consultants and midwives, the folks that may be filling in the gap where obstetric violence or systemic racism may be happening in larger institutions. Let's envision the safe, sustainable communities we want to live in. Let's think about what is it that you need to have a healthy life. What would you need from your provider? What do you need from your state, from your city? Let's envision what that looks like for us so we could start planning it together. And let's listen to the most impacted communities. These are the folks that don't always have a voice, don't always have a way to share, don't always have the resources to get better care. Let's listen to their experience and learn from them. Let's address systemic racism. This is the big problem. Black women are dying at a higher rate because of systemic racism for no good reason. Build a proactive policy movement to change outdated and harmful systems in Arizona. That looks like taking all the information that we know, talking to the people who are affected, and then figuring out what can we do? What can we really build? A legislation that actually helps our community and not hurts them. Because more than anything, reproductive justice is for everybody. And this brings us to the end of my presentation. And I think we have a little time for some Q&A and some more comments. And I also want to open it up for Dr. Taylor to add any sort of like information in her perspective as well. I would love to invite you to join and add anything that you think may be helpful in this conversation.
The only thing that that I would add to this excellent presentation is that the states that have the most restrictions on abortion also have the worst maternal mortality rates. And there is growing evidence that is showing this. And so even prior to the Supreme Court Dobbs decision that overturned Roe v. Wade and took away federal protection for abortion across the country, we were already seeing the impacts of the restrictions that were occurring over time and its impact on maternal health. And for me, this is such an important point to bring home, is that when we are telling people that we are okay with them not being able to access an abortion when they need it, and for whatever circumstance they need it, then we're telling them that we're okay with them dying. And I think we need to stand and be comfortable in saying that to people, because the anti-abortion extremists use very emotional language to invoke feelings. And we don't necessarily need to figure out what to say. Like, the data is right there. When I tell you that I'm okay with you not having an abortion after 15 weeks in Arizona, and I'm asking you to jump through hoops to figure out where you can go to another state, and like the whole, like when you start to travel east, there's, hardly anywhere that you can go, then I'm telling you that I'm okay with you risking your life. And granted, people risk their lives to have children all the time. However, we want people to continue a pregnancy and assume that risk when they are ready, not being forced. So that's the key there. And so that's something that I am leaning into a lot more intentionally when I'm having conversations about abortion. And then the other thing is, abortion is among the spectrum of decisions that people make when they're pregnant. So really talking about abortion in the context of pregnancy, it's time to stop putting abortion out here off to the sideline as this thing that people do. And we're ideologically, philosophically like, it bans off our bodies. At the end of the day, people are not making decisions to have an abortion in a vacuum. Their entire life is happening, and they're making a very important decision about whether to continue a pregnancy and and add to their family or start a family or not. And it's generally about their family, their community, their finances, et cetera. And so reproductive justice becomes a framework that allows us, as Michelle said, to look holistically at what options are available to people to not only survive, but to thrive. Make no mistake that our ability to control our reproduction directly impacts the trajectory of our lives and our families and our communities. And so that's all I wanted to add, and we have some time for questions.
Folks are able to come off mute if you like. If you have a comment, you can also add a comment. We'd love to hear your thoughts about what you heard, if you learned anything new today that you want to share. Cassandra says, I really appreciate hearing and seeing your emotion and passion as you say all this. Absolutely. Yes, Dr. Taylor, I love to hear her talk about this, and I learn something every time I hear her talk. So, absolutely. And Sandy says it's the best definition of the difference between reproductive rights and justice. Yeah, a lot of these conversations are not being had in the reproductive rights movement, and it makes all the difference. Thank you. Brittany Lee says, thank you for all this great info and wisdom. Absolutely. And I see Sandy, you have your hand up. Go right ahead.
I've been attending a lot of workshops and webinars, things like this. And even in Illinois, we're one of the only states that you can get abortions in the Midwest. And our state protects the providers and the women that are coming in from out of state. And I even hear there's the problem with economics as to who can afford to have abortions, even if they live, say, in Illinois. And we have the same problem with rural areas. And that's it is a class thing. It's an economic thing.
Yeah, absolutely. So yeah, as we were having that conversation in the chat about, there was this quote that I put in my book that someone raised when I was talking about the book, and I can give some more information before we end about that, is like, I quoted someone who said, abortion was available to people if you could afford it and find one. So it's like, that is really so important about this aspect of it. It's and that's what's wrong with the pro-choice framework. Like, it is a privilege to have choices, because there are a lot of people who can make a decision, but then don't have the resources to act upon it. So do they really have a choice, right? And so that is a really important thing for people to remember, that it's really important to understand that we want people to get abortions. And so when we're talking about this and we're discussing and figuring out how to improve access, then we really have to say that what we are doing, or we are trying to create the conditions for, if someone decides that an abortion is the best thing for them to do with this pregnancy, then we are creating the conditions for them to actually be able to get it. And so we need to be not kind of philosophically and hypothetically and, pro-choice. Like, it's time for us to stand in the conviction that we are making the conditions for people to have abortions. Michelle, did you have anything you want to say about that?
No, I think that I just hope that as we move forward in this, in trying to, folks are saying to reinstate Roe, but really we have an opportunity to broaden the scope of what is available to our communities. We really have the opportunity now to go back to the drawing board and say, okay, what was missing? What really needs to be added? What, like you said, the rural areas, this is huge. It's a huge issue all over the country. And so we have an opportunity to, fill in those gaps now more than ever. So I welcome you and I challenge you all, and when you're talking to folks or you're in spaces where there's other, advocates and other, maybe legislators, to bring these things up, to remind them that it's just not enough to have the choice, and then to talk about all these other issues that affect, poor folk, indigenous folk, black folk, folks in the rural areas, folks getting their kids taken away because they're a different color, or they don't make as much money in hospitals. There's just so many things that are happening that affect us having healthy communities, and it's at this point, we can do better and we should do better. So Mary says education is so important to help break down stigmas. Thank you so much for all your hard work in facilitating this. Of course, thank you so much, Mary, for being here. It's an honor and a pleasure. I wish we could do this all the time. This is, this needs to be done over and over again and shared in all communities. So we're just like, it's a drop in the bucket, but I'm glad that you're here for it.
Indeed, that's why it's important to get involved with local and state elections. Illinois and Wisconsin had tough state Supreme Court elections. Yeah, what we're asking people to do is understand that we've reached a moment in time where we can't just not be political. I don't do politics. As people with uteri, our existence is political at this point. To not find a way to participate, whatever your time, talents, and resources allow, then what we're doing is we are ceding the ground to extremists to have minority rule over us. And so the only way that we turn this around is to actually be engaged and informed. And as we learn and know more, then share that information. And I remember seeing a quote somewhere, democracy dies in silence. And that is so true.
Agreed. It has been dying in silence, but silence no more. I want to thank you all so much for joining us today. It is, even in these hard times and these very difficult situations that we all are facing, it feels very supportive and inspiring to see you all come to these webinars, to learn, to share your ideas, what you're going through in your own state. It really helps us feel like there are folks on here that care, that want to learn more, and that are willing to take that extra step to make, reproductive justice a reality. And so even though you may not call yourselves that, I now name you all reproductive justice warriors. And so you're with us in this fight, and thank you so much for joining us. And if you ever have any more questions, or you would like one of us in our organization to come and give a talk to your organizations or your groups, please feel free to reach out. We would love to bring more information. This is just like just a little bit of sprinkles. We can go really deeper in any one of these subjects as necessary. So thank you so much. I'm gonna go ahead and stop the recording now. Let me see if I can do